people having horrible lives.
Yeah.
In other words, it can lead to depression, and the route that takes people down, and maybe even medications, and you wonder to yourself, well, what's the quality of life like now, So it's going to interfere with children. I mean, my God, the kids here haven't been in school. They ended school early, so we've been on lockdown for we're in our 12th, 13th week.
Yeah, you guys are much longer. And is there, like in Australia, we're getting JobKeeper and JobSeeker, we're getting financial stuff, and Canada's getting it if they've got, if they're not generating an income. We're getting it if we're less than 30% income. What have you got over there in Ireland?
Well, we have a scenario where obviously you can imagine touch therapists are not working. And because they're not working, then they're able to get a government allowance, which is about, in terms of dollars, it's probably close to about $540
per week.
Per week. So, I mean, it's an income, and it's certainly has been, I think, beneficial to people and welcome to people. But again, the economy can't afford to keep going with that indefinitely. It's just not a possibility. So we need to get back to some kind of normal economics. Because we obviously, the clinical side of things is one thing, but then it's the delivery of courses is another. So the delivery of courses with universities and colleges opening up, and let's say you're doing a course in psychology, or you're doing some other marine studies, or whatever it may be, you can space the students out using your 1 meter or 2 meter social distancing approach. But in touch therapy, you can't do that. In touch therapies, you have to be touching people.
Yeah.
So either it's going to be a case that we're allowed to go back at some stage and touch, or they're going to be saying, until such time as there's a vaccination, no. And if that's the case, then you're going to find that I don't know how schools will go back.
No.
I don't know how schools will reopen.
So it's still quite rife over there in the UK?
Well, the UK is different to Ireland insofar as the UK handled it differently and then tried to kind of play catch up, we'll say. The numbers of deaths in the UK are really horrendous. They're over 100,000 deaths. I mean, I haven't heard what the latest number is this morning, but somewhere in the region of maybe 110,000 deaths. And that's for a country that has a population that 1/5 the population of the USA. So, and the USA have 110,000.
Yeah,
so
too much.
They have a big part. So the UK, sorry, beg your pardon, 50,000. America was 110. The UK is 50,000. So it's half the number of deaths for a population that's 1/5 the population of the USA. So really, I think the UK, that's not a good scenario there at all.
No. So how's it going in Ireland?
Yeah, in Ireland now we've had a couple of days where we had no new cases and no deaths, and it's under 10.
So you're like us.
Yeah, I think so.
It's funny because we're getting released and relaxed in what we can do. But I suppose it's ours, and it's a state by state. So we were one of the slowest states to change. New South Wales, which were the ones that brought the bug in,
right.
They jumped on really quickly. But we're still not travelling. You can't travel interstate.
Okay, and we're allowed now to go outside our counties. We're allowed to go 20 kilometres beyond the border of the county. So our phases have changed as well. We had 5 phases and now it's down to 4. So they kind of brought the 5th phase into the 4th phase, and we're slowly getting back. And, people are, people did behave themselves well. Now, if I'm driving, I have to go into the college later today. I've had to go in and out on 1 or 2 occasions to the college for particular reasons, or even drive. I live close to a beach here, so I go down to the beach. People, it's really disappointing. People are acting as if there's no coronavirus around at all. It's really crazy. So in other words, what I'm saying at the end of the day is, you vote in your government. It's a democracy, and what you have to do is you have to go with that. You can have an opinion, you can express that opinion, but I think you have to go with government. It's the job and the role of newspaper reporters, TV reporters, radio. It's up to them to challenge you know, the status quo, and it's up to them to challenge the politicians and to put the hard questions to them and to put up an opposing argument. But as a citizen, whether we voted in this crowd and they're the people making the decisions, so okay, what decisions have they made? Well, then stick to them. That's what you've got to do. You can't try and say, well, I think they're wrong, I'm going to do the opposite. No, that's not how the democracy works, which is what I'm saying, that, you know, I'm looking at different experts. I won't necessarily name them here, but you can look at them. I mean, well, I'll name one. There's one who's Professor Cahill, and she's Professor Cahill was the director of the Max Planck Institute in Germany, and she's basically saying that it was completely and utterly dealt with incorrectly. Now, this is somebody who's an expert in epidemiology and in, you know, virology and so on. And you're thinking, well, hang on a second, if she's one of the world's leading authorities and she's saying that we've all got it wrong. Well, at the end of the day, I think that's more conversation retrospectively. I think that needs to happen and those voices need to be heard. But after the fact, in other words, this is the problem, that this is what causes people confusion. They say, well, I was told or I heard this, you know, it's like, that's fine. Well, let's make a note of that. And what we need to do is we need to stick with the plan that's been put in place, because you can't keep changing your plan halfway through into, well, you know, with something like COVID, you have to have a strict plan, then you stick with it for the duration.
As they first did the first relaxation of how often we, like, if we go and catch up with 10 people, or we could go out more than 100 kilometres or 50 kilometres, people kind of suddenly went, we must be all right now. We actually must be, you know, we're better. And the amount of times I've pulled people up and said, don't put your finger on the elevator button. Use the back, like, use your key. Don't, just because we're relaxing what we can do doesn't mean you turn your brain off. And that's what I see all the time. People just go, oh, it's relaxed, so it's out of mind, out of sight. You know,
well, in the very early stages, in fact, we shut down the college in March, and I can remember it was within a week, I think, or maybe within a week or two, and I was coming into, you know, one of our shopping centres, shopping mall, here near where I live. And of course, they have the, you know, the barrier comes down and you come up and you press the button, you get your ticket, barrier goes up, and then you go. And so I rang one of our radio stations here in Ireland called News Talk, and I got onto the newsroom, and I was talking to the guy in the newsroom, and I said, would you do me a favor? I said, if you could. And he said, yeah, what's that? I said, could you make an announcement? Because they're a national radio station. I said, could you make an announcement? I said, to the companies that are running and operating the parking within the various different shopping malls and shopping centres in the country. Could you tell them to just leave the arms up and let traffic just go in and out? And he said, sure, why would they do that? And I said, well, look, it's touching the button to get your ticket. I said, you have to stop touching buttons. And he said, but sure, how would they make their money? And I said, well, they're not going to make money. I said, I've just shut my business down, you know, a week ago or whatever it was. I'm not making money. I've had to, that's what you do in a scenario like this. And this guy working for News Talk, as I say, a national radio station, he just couldn't get his head around it. And he's a guy who's gathering news. He's the guy who was then going to be reporting the news. And I was thinking, if I can't make my point to a news reporter,
a journalist,
journalist. Now, about a week later, all the barriers were up. All the barriers. So they had obviously cottoned on at that stage. But in the earlier stage, I just don't think people understood or knew what it was that was going on. And in fact, in the early stages, I would have been recommending that people would, you know, they were asking, what will happen, John, when we go back? And I was in the early stages thinking, yeah, we'll wear gloves. But of course, as we start to learn more about, you know, that this particular virus and viruses generally, you know, things began to unfold, and then we began to really have a clearer picture of things. And so now we realize that, okay, the wearing of gloves, you can still do it. That's not an issue. You can still wear gloves, but you don't have to wear gloves. In other words, it doesn't actually have any significant effect in reducing the risk of the spread of coronavirus. You know, because as long as you don't start touching things and then putting your fingers in your mouth or close to your eyes and nose.
And the same as you can't, there's no point in wearing a mask if you have facial hair. It's like it's completely out the window. So a lot of our ambulances, fire brigade, police officers, a lot of them chose to shave, and we're very beardy and mustachioed
Right.
down here in you know, Paleolithic land in Australia. So they were shaving it off because they were going, we can't ensure a full tight seal.
Well, no mask gives you full protection against coronavirus. You can have, the idea would be that, let's say you have a material and then you triple fold it or double fold it to give you a triple kind of layering. And the idea of that would be that, let's say this is a small little opening that a coronavirus can get through. The idea would be that if that's one lamina, one layer, then the opposite, the next layer would be here, so that it would stagger the openings, because coronaviruses are so small and the nanoscale that there really isn't a material in your typical face mask that can stop the coronavirus from getting through. All you can do is try to put barrier upon barrier upon barrier. And then when you're using those kind of face masks, you know, obviously there are ones then that will have filters, and the filters are small enough to be able to capture the corona. So they're the medical face
respirators.
masks. Yeah, and the respirators, it's exactly what they are, as opposed to just simply calling them face masks. What we need are face coverings, just in case we sneeze or cough, that you don't want to have the particles going directly at the client or patient. And the truth of the matter is, as I say, it's only just as we say in Ireland, to be sure, to be sure. You know, it's just another. The most important, as we said, and is hand washing. Create bubbles. So you could be living in an area where the water is quite hard, so you might want to make sure that the water is warmer. And if it's not hard water, if you have a softer water where you live, then it can be cool water. It's fine. Doesn't matter hot or cold. The secret is creating bubbles and interdigitating and pulling the skin back so it gets in underneath the cubicles. And you got to get into all those little nooks and crannies. You know, but the bubbles get in and they do something called closest packing. So they basically take up all the available space. And so therefore that causes the coronavirus to explode. It's that simple. So creating bubbles when you're washing your hands, that's really the most important part of it. And nothing better than a mild detergent like a soap. Nothing better than a soap to destroy both the bacteria and the viruses. You've bacteria all around here. We've bacteria that if they get into your upper respiratory system, they'll give you like a sore throat, or they'll give you a runny nose. And you know, we've known about these for years and years and years. So an antibacterial wipe on your hands or proper washing will take care of them. But I suppose my guideline to everybody would be in the touch therapy world would be certainly be washing your hands once every hour, or at the end of every treatment. And that to me, I think, is the most important. Of course, keep your clinics clean and try to minimize what you have in the clinics. You know, in terms of the coronavirus needs a surface
and the linen to actually remove things from there as well. So.
As much as possible, because it needs a fatty protein to sit on, to live on. And it's a funny thing when I say to live on. That's another peculiar thing about viruses, because viruses are not alive.
No, that's right. Conspiracy theory.
They are a bit of DNA. That's what they are. So they're they're almost like a master lock, or beg your pardon, a master key that can fit into all sorts of locks. And so they get into the body and they can you know, match and fit in with other strands of DNA, and then that causes havoc and causes problems. But you know, I think it's a good idea that we just take a reconnaissance of the clinic and what you have in your clinics, and just try to make sure that you're minimizing, you know, chairs, stuff that might have been nice, it might have been decorative perhaps, or maybe it was easy for you for filing things, but then move that to a separate room.
We've removed magazines, all the magazines and all that information out of not only our clinics, and that's the advice from Massage and Myotherapy Australia amongst other associations, but also out of all the doctor surgeries. All of those little brochures that you would normally see, they're all gone, as rightly as they should. in this time.
All these little things help, you know.